diseases are not defined by a set of criteria.
Yeah.
They're this continuum, this process. If I don't get my act together and start trying differently, then I'm going to lose whatever, what little I have left. The first thing I did was I went back to basics. And so I did, I did not suddenly just start seeing an acupuncturist or start, trying energy medicine or anything that's really alternative. I was like, okay, no, I'm a doctor.
You didn't start off with crystals?
No, I didn't. I didn't. And oh God, meditation was like pulling teeth. So no, I went back to basics, and I took out my Pathology 101 textbook.
Yeah.
Right? Pathologic basis of disease.
Robbins
right?
and Cotran.
Exactly.
That's we all take it first, second year medical school.
Right. And Kumar was my pathology teacher.
Oh, wow.
So I took it out. I still had it. It was highlighted, dog-eared. I mean, it actually was good for me. Like if I know neuroplasticity, right? It kind of brought me back to this time where I had more of a sense of agency over my life. So in that sense, it was also healing. I didn't recognize it at the time. But I started reading about how chronic disease develops, and, about cellular repair and cellular injury. And I was like, wait a minute. And they actually talk about, this was published, I don't even know which edition, but 20 years ago.
Yeah.
Where they say the one cause, one effect paradigm does not work anymore.
Yeah.
Right?
Yeah.
We're in this complex living environment where nutrition matters, where environmental toxins, this is 20 years ago.
Yeah.
And they probably wrote that several years before that it was published, right? So I started reading that and I thought, well, wait a minute. And then that diseases are not defined by a set of criteria.
Yeah.
They're this continuum, this process.
Right.
And that
so I remember going back and reading chapter 1, and it said any pathologic change is always preceded by a biochemical change.
Yes.
Which means that anything you see like on a microscope, there's got to be a lot of years of stuff going wrong with your biochemistry and physiology before that happens.
Yes,
and
years.
We don't know how to look at that in Western medicine. We just wait till you have something wrong, and then we go, oh yeah, now I don't know what it is.
Right. Because in the way that we've been trained, inflammation, which is what I had, right, widespread inflammation in my nerves, inflammation in my gut, inflammation
in your brain,
in my thyroid, exactly.
Your muscles.
It doesn't qualify as a treatable disease.
Inflammation, no.
Right.
No, that's what I was joking. Say functional medicine doctors are inflammologists.
Yes, I love that. I remember that from the first functional medicine conference I went to.
Yeah. Where I gave a talk on that, right?
Right, right. So, so that was a really big aha moment for me. Was wait a minute, okay, I understand this sudden disturbance, what I call it in Beijing, but then I had the thyroiditis before that, which was sort of the preceding trigger.
Yep.
And then before that, okay, wait a minute. You know what? When I was in residency, post-call, 36-hour shifts, my muscles would feel like really crampy.
Fibromyalgia.
Like I felt like I'd run a marathon. And I was dizzy. Yep. And I just assumed, well, of course, everyone feels this way because they're exhausted.
Not sleeping, right.
Right. And so I started going backwards and realizing, okay, this has been going on for a long time. And for some people, that can be really, sort of disheartening. But for me, at where I was, it was a little ounce of hope because it meant that I could sort of stepwise, piecemeal, address inflammation in a way that I could tolerate. What I was really afraid of, because I was so brittle, was having any kind of setback that would push me down further. Mm-hmm. And so if I could do it in a way that was more controlled and gentle, then it felt like something I could move forward with.
So what did you do?
And
or the things that helped you recover?
So, one of the things was, was identifying.
By the way, chronic fatigue syndrome is not something most people recover from, right? Fibromyalgia is not something people recover from.
Absolutely.
Unless you see a functional medicine doctor.
Right. Or have some one of those, spontaneous remissions, which is 1 in a million, probably. Yeah. Right. So so what I ended up doing also was distancing myself from the diagnosis and the prognosis because it was more despairing.
Yeah, you can't
My
focus
marriage
on
was
the
held
name.
together by a single thread. You know, I had 2 young kids. I had everything to lose. So I was like, if I don't get my act together and start trying differently, then I'm going to lose whatever, you know, what little I have left. So I was really motivated. And, you know, the first thing I did was really, I started reading about, well, I knew I had to get sleep. If I can't get sleep, I'm going to not have enough energy.
Mm-hmm.
So really understanding the circadian clock. And, you know, I learned things that I was surprised I didn't know already. You know, I knew about the pineal gland and the hypothalamus, and we have this master clock, and we have jet lag, and that's why. But I didn't know about every organ having its own clock, and own rhythm.
And there's even a whole field of chronobiology where different kinds of chemo is better given at different times of the day to work better.
I know.
This isn't conventional medicine.
Right. And it makes like complete rational sense, right? So I started, first of all, being more regimented about just, okay, you know, I'm going to wake up, you know, and get up out of bed, even if I feel kind of miserable, but my body needs to know that it's awake and that it's alive. So really basic, fundamental steps. And I learned that when we deviate, I mean, particularly when you're brittle like that, I mean, of course, when we're more resilient, like now I have much more flexibility. But when I was brittle, you know, when you stray away so often from a routine, it causes stress on the body. Mm-hmm. So I was like, oh, okay, this is maybe an easier way where I can reduce stress on my body.
Yeah, rhythm.
Yeah.
We all live dysrhythmic
my dog,
lives.
I feed my dog at the same times every day.
Right.
Why don't I do that for myself?
Yeah.
You know, and he gets walks now at the same time. Why don't I do that for myself? Mm-hmm. So I started syncing myself also with my kids, right? Like, okay, I'm going to take care of my kids. I can take care of myself at the same time. So I think that also as in that caretaker mentality, you know, as a mother or a partner or a doctor, is we tend to put ourselves last. And so it was kind of time to put myself first, you know, as my first patient.
Mm. Yeah. That's good. And so you did the rhythm. And what else? Change your diet.
And then, and, you know, a lot of it was just asking new questions. The diet piece, I thought I was eating, quote, healthy. You know, which was largely vegetarian. I was cooking meals, but also doing a lot of prepackaged meals, but, you know, not a lot of processed stuff. And it wasn't until I saw an acupuncturist. So the acupuncturist that I saw, Robert Levine, who's in Berkeley, California, he was brilliant, really brilliant. And he's still practicing, and he's a good, dear friend of mine, a mentor of mine. I learned a ton from him about understanding the body in terms of systems. So when my thyroid was out of whack, it wasn't just my thyroid. It was my whole hormone system, which is tied then to the digestive system, which is tied to the immune system. Like it suddenly started making
bones
sense.
Connected to the thigh bone, right?
Yeah, exactly.
Like that old song.
And the body is connected to the brain.
Which is actually amazing in medicine that our entire training teaches us the opposite. That there's all these organ systems, right? We take the GI system and the liver and the lungs and the brain and the heart and the hormone. And you go to specialists for every different part of you and nobody connects the dots.
Right. Right.
And traditional Chinese medicine is actually a system of thinking of the body as a system. And that's what functional medicine is. It's a systems thinking approach.
Yes, absolutely. And so, you know, we can extrapolate that to any size system, right? We look at our communities and our world, right? And, you know, one of the things I feel like that drives almost everything, if not everything, that we do as individuals and that we do as societies is, how do I get more energy?
Yeah.
Right? My Qigong teacher was talking about that. Yeah. How do we get more energy? You know, whether it's through, you know.
And Qi means energy.
Yeah. Whether it's through solar energy, you know, fossil fuels, whether it's, it's food, nature, movement. So, you know, I began to shift my thinking in relationship to health and disease in a much more living, sort of embodied way. So the diet thing, he was the first one. He was like, you're so deficient right now. Like, I think you need more meat, you know, and you need more of these heavier foods. Like, you're doing lots of salads and which are great, but not for you right now. So I hadn't even thought about a personalized diet.
Yeah.
And I was like, more meats? What are you talking about? And this is before paleo days and all that. And
meat was the enemy.
I began researching ancestral diets and, the work of dentist Weston A. Price.
And Melvin Connor's
work. Right.
Yeah.
And it suddenly made sense. Like, oh yeah, like, okay, I'm going to eat like my ancestors ate. I'm going to prepare food the way my ancestors prepared so I can maximize nutrient density. Nutrient density equals more energy.
Yeah.
And then the gluten issue came up. I was really skeptical of it.
It's one of the biggest drivers of thyroid disease, Hashimoto's.
Yes. And the celiac experts know that, but the endocrinologists don't.
Right.
So there's no crosstalk there either.
Yeah.
And this is in conventional medicine, right?
Yeah.
So, and I do remember asking my endocrinologist, like, what can I do? What can I do? And he said, nothing, it's genetic.
Oh gosh, no, it's not.
Right. It's a genetic predisposition, but not predetermination.
Yeah.
And but the gluten thing didn't actually arise. I think I was partly in denial about it. There were lots of rabbit holes that I knew about, and I just didn't want to go down. As long as I was steadily getting better, it was my older daughter she was 5 at the time. I was taking her to her first dentist visit. And, I felt like as a family we ate pretty well. She didn't do a lot of sweets. But she had not just one cavity at her visit. She had 6 cavities.
Wow.
Yeah. And I was floored. So, and the dentist kept saying, well, don't feel guilty. And I was like, wait a minute. Like, I wasn't feeling guilty until you just said that. But it made me investigate, like, something else is going on. Like, I know how we eat. I know how she brushes. And I know cavities happen, but like 6, it didn't compute. So I started researching, and that's when I came across Weston A. Price's work around the condition of teeth tied directly to diet, but then going deeper. And then in my research, I came across gluten, and gluten causing enamel defects, gluten, causing inflammation in the gut, which therefore could translate into poor oral hygiene or just conditioning of the gums and the teeth. And so that was just kind of another step in that process when I realized, I got to go back. And again, this is not unconventional. This is
just traditional science.
Hippocrates said all diseases begin in the gut, right?
Yeah.
So we're just kind of going back. And I realized I have to learn how to heal my gut as another step.
And did you still have digestive symptoms after that initial gastroenteritis in China, or did it get better?
They were largely quiescent until I removed gluten. And I removed gluten, and I had massive withdrawal. Diarrhea, irritable bowel, and again, this was kind of before the time that I realized I understood about detox and how healing happens. Is that often it gets a lot worse before it gets better, and that it could be a good sign. Mm-hmm. So I was really frightened by how severe my reaction was when I stopped gluten. So I was thinking it was a bad thing. But then, you know what? I stuck with it, and a week later it calmed down, and then my health improved a notch. So, and not only that, but we changed the way that our whole family ate. And my younger daughter, so my older daughter's teeth, really basically resolved. I mean, they became really strong. Some of her cavities even filled, like they recalcified and didn't have to get filled. My younger daughter, who didn't really have any thing that was alarming, but she had like this perioral eczema, which is this dermatitis, which is very difficult to treat with. It's
often dairy or
with steroids. I mean, which is how we treat most dermatitis.
Anything red on the skin, they put steroids on it.
Exactly.
Why is the skin irritated? Coming from the inside, not the outside.
So she had that, and she would get asthma when she got colds, and both of those are totally resolved. Yeah.
Off of gluten.
Well, off of gluten, but also doing the ancestral diet.
Mm-hmm. So off of dairy.
Yes.
Mm-hmm.
Yes.
Yeah.
And, you know, so it was just one of those things. I was like, you know, you can't make this stuff up. And this stuff isn't written up. And it's very individualized. So,
but if you look in the literature, you know, doctors say, where's the evidence? Where's the evidence? Well, there's 900,000 papers published every year. Most doctors haven't read that many of them. And the truth is that most of the ones that are on these subjects are completely ignored. And when you put all the dots together, there's a pattern there in the data that suggests that these things are real, that there is something called leaky gut, that there is inflammation that comes from the microbiome, that, you know, foods do cause reactions in the body that lead to all these diseases, that heavy metals and toxins are an issue that cause disease. I mean, there's no lack of data. It's just not data that doctors pay attention to in the literature.
Right. And, you know, and it takes on average 14 years. I thought this
17.
17.
Yeah.
Oh, God.
That's not a good day.
For information.
That's not a good day.
Information and research to translate over to clinical care.
Yeah, I think that's not a good day. The guy who discovered that we should wash our hands before giving, you know, any surgery or childbirth was basically ridiculed for suggesting that doctors could be causing their patients to get sick by not washing their hands, and he was basically exiled and ended up dying in sort of disgrace with no money and, you know, excommunicated from the medical community, Semmelweis, and it took 50 years for them to go, oh yeah, maybe we should wash our hands.
Oh my God. No. Where's the science on that, right?
Yeah, right. Well, so, it was an anathema to doctors that, oh, you could suggest that a doctor would be causing their patients to die from childbirth fever because they didn't wash their hands. That's nonsense. You know? So that it is tough to change medical paradigms.
Right. But I mean, some of it is common sense.
Yeah.
We don't need science to show us that, right?
Well, I mean, when they didn't know about bacteria, common sense was, you know.
Yeah, that's true. That's true. Yeah. So, yeah, I mean, I kind of just did this stepwise progression to get to the point where I was much more able to get out of the house.
Yeah.
And then, and one of the things I also explored, which I would say maybe is down the unconventional path, was I began to shadow integrative doctors on just different paths in integrative medicine, or sort of, you know, I didn't actually know about functional medicine at the time. So I was shadowing an anthroposophical medicine doc, you know, someone doing like sort of anti-aging hormone therapies. And then it was when I was shadowing a integrative pediatrician who said, well, you know, I was still unwell. had taken off work for a couple of years, but I was starting to think like, oh, how would it look if I were to return to work? Like, what are the different ways I could practice? Yeah. And it was the pediatrician who said, well, what are you interested in? I said, well, you know, I love the traditional Chinese medicine paradigm. It makes so much sense to me, the systems thinking, you know, about the gut, you know, sort of being the foundation of healing. And I'm really, you know, ancestral health, you know, figures into it. And she said, it sounds like you're interested in functional medicine. I was like, what is that?
What's that?
What is that? So, and she really strongly recommended that I go take this course with the Institute for Functional Medicine. Yeah. So it was sort of a bone for me, right? Like I was aiming to get healthy enough to be able to travel, to go attend a conference. And so, and it came to Santa Monica, and I live in the Bay Area. So it felt doable. It wasn't, cross country. And I went, and it was, I think I had that aha moment like you did when you listened to Jeff Bland. I was like, oh my God. And like, this is something that's been developed and developing, and there's a framework. I don't have to make this up.
No.
So it was a really important turning point for me. It gave me hope, both in, you know, as a patient, but also as a doctor.
You know, the microbiome is one of those areas that is blowing apart our traditional concepts, right? So the microbiome is this ecosystem of bugs in our gut. It's trillions of bacteria. It outnumbers our cells by 10 to 1 and outnumbers our DNA by 100 to 1. And it has been linked to everything from autoimmune disease to cancer to heart disease to diabetes to obesity to autism to Alzheimer's. I mean, the list goes on and on. So when you go to the rheumatologist, they don't go, how's your poop? But we do, right?
We absolutely do.
So let's talk about the gut in connection to some of these diseases. We treat something a lot that's called Sibo. Now, when I went to medical school, this wasn't even a thing, but essentially it means small intestinal bacterial overgrowth, which means bad bugs growing in the small intestine where they should be sterile that have an impact on our health. So what are the symptoms? How do people know they have it? And what kinds of problems are they connected to? And let's kind of get deep into what our approach to diagnosing and treating it's going to be.
Sure. So, I just want to be a little cautious here because we're jumping right into talking about a disease.
Yeah.
Right?
Well, it's not a disease.
Sibo,
it's a phenomenon.
It's a phenomenon
that actually causes all sorts of other problems.
Right. We do have to give things labels, but it is a phenomena that's connected to many different parts of our body, and getting somebody better involves the whole lifestyle spectrum, and it involves us using something in the functional medicine realm that we call the matrix. And the matrix is looking at not diagnoses, but conditions.
Yeah, let's talk about the matrix.
Yeah.
Tell us more about what is the matrix?
Yeah.
How does it differ from traditional diagnosis? And
why
do we use it?
For me to tell you about the matrix, you have to swallow the red pill, the blue pill. Which one do you want to swallow?
I think I'll take the red pill.
Okay, take the red pill. That's the right pill. Okay. So anyhow, now I can tell you about the matrix. So the matrix is basically a construct that we have in our minds where when you start telling me, I have headaches, I have fatigue, I have belching, I have bloating, I have a diagnosis of Hashimoto's thyroiditis, migraines.
Lupus.
They don't become the endpoint. They become part of the narrative of your disease. And we put it together into a story we call the matrix. And so we look at assimilation, which is the gut. We look at energy. That takes us from, an idea of fatigue. We rattle it down on our brain to what are the things in the body that control energy, right? And so we think about mitochondria. When we think about energy, we think about toxins. How do toxins influence the rest of your well-being? We think about our transport system, our blood vessels, our lymph drainage, and the connection between lymph drainage in the brain and your gut, leaky brain, things that we'll talk about. And we think about the hormonal system, neurotransmitters to adrenals to thyroids. And we place this all in our mind in this matrix, this paradigm of thinking, and then we make the connections. Yeah. We say, okay, what's Sibo? Okay, well, it's going to be symptoms, bloating, distension. I feel like you've used the term food baby. There's something always in my gut.
Yeah, when you have a food baby, and you feel your belly bloat up, that's called Sibo.
Right, that is Sibo. You don't feel like you fully evacuate when you have a bowel movement. You're fatigued, you get depressed, and you can actually feel your depression, and it's related to how your gut feels. I had that food baby. I'm anxious. I feel depressed. It impacts my ability.
And it can link to all sorts of other diseases, right?
Fatigue. And then when we think about fibromyalgia, we need to think about the gut and what's been impacted there. And we think about Parkinson's. 50% of people with Parkinson's actually have Sibo.
Yeah.
Now,
asthma.
Right. And we don't know.
Diseases.
We know there's an observational connection there. We don't know anything about causality, but it's something you have to consider when you're thinking about other diseases. So the fatigue, the brain fog, the potential inflammation and joint pain, all of the gut issues, that's Sibo.
Yeah.
And a lot of Sibo, we don't know all the causes. There used to be some standard ideas what the causes were, but now we know that it's hard to determine. So the use of proton pump inhibitors and other
acid blockers like Prilosec, Prevacid, all that stuff.
All that stuff. And then we have stress plays a major role. And so that's some of the cause. That's what Sibo can look like. And now, how do we address it? How do we get people better?
I'm just going to back up for a second. Yeah. You mentioned these acid blockers because they're given out like candy. You can buy them in the drugstore. They're over the counter now, and people think they're safe and fine. I remember when I went to medical school, they just came out, and we were told by the drug reps, these are very strong drugs. They completely shut down acid in the stomach. You never want to give them more than 6 weeks. And now people are on them for 6 decades, and what they do is pretty frightening. Literally, they will help your heartburn, but the side effects, which are not really side effects, they're effects. We just don't like them, so we call them side effects, are bloating and diarrhea and distension, all the Sibo symptoms. And by the way, they cause osteoporosis and pneumonia and prevent B12 absorption and zinc absorption and mineral and magnesium absorption. So they're not exactly the safest things on the planet.
I just have to say this, Mark, and is that this is the concern we all have for medicine when we've been unplugged. And this is the issue, is that we have pharmaceutical companies that provide medications to our patients to support sick lifestyle that perpetuates disease.
Yeah, I love those advertisements on TV where they're like, don't worry, eat your like sausage and peppers, and don't worry, just take this Prevacid or Prilosec, take the purple pill. It's ridiculous.
It is. And so but on the functional medicine side, here's where the hard work is. Changing the lifestyle to make it a healthy lifestyle so people can, be healthy, prevent disease. If they do get sick, then we help them change lifestyle because that can impact disease more than anything else. And then for people who are well or have gotten better, we can use lifestyle to optimize their aging. And again, using a term I've heard you use, age young. And that's part of what we do here at the Ultra Wellness Center, the whole spectrum: prevent, treat, and then help people optimize and age young.
Yeah, my goal is to die young as late as possible.
So back to the Sibo thing, right? It's so once we make that, now how do we make the diagnosis? So I always tell people, tests are good, but there's no perfect test. And your cognition, your doctor's ability to think through problems is the most important thing that they can do.
That's what we do in functional medicine, right? We are thinking differently.
All the time.
My mentor, Sid Baker, who's one of the leading, I think, medical minds of the last century, who's really pioneered a lot of the visionary concepts of functional medicine. He says, we're in the name it, blame it, and tame it game. We name and blame. We name the disease, then we blame the name for the problem, and then we tame it with the drug. So we say, oh, you're sad and hopeless and helpless. You have depression. That's what's wrong with you. No, it's just the name of what's wrong with you. It's not the cause.
Right.
And we go, oh, I know what you need. You need an antidepressant. And that's like, it just doesn't make sense. Instead of what we do in functional medicine, it's called thinking and linking.
Right.
We actually
think and link constantly.
Everybody thinks you treat the same disease with the same treatment. And in functional medicine, you can have 10 people with migraines or
treat everyone differently.
Everybody's different,
Absolutely.
right? 10 people with lupus, and everybody's treated differently because you're looking at what the root cause for them is. And I think that's really profound.
Yeah.
And I want to get back to the Sibo thing, but I just want to come back to the matrix because that's such a key concept.
Yeah.
And you described all these biological networks, assimilation, which is the gut, defense and repair, the immune system, energy, how we make energy, detoxification, our transport system, our circulation, our communication systems, hormones, neurotransmitters, our structural system. And all those are influenced by our lifestyle, by our thoughts, our feelings, our relationships, our diet, our exercise, our sleep, all those things.
Intrinsic relationship.
Yeah. And then they're also influenced by external factors like toxins, allergens, bad bugs, stress, poor diet. And those impact our genes to change the expression. And so we have basically our inputs that are a problem and then our lifestyle, and that causes disturbances in these systems. And no matter what disease you have, we use this model, and every single chronic disease and even many acute diseases are caused by disturbances in our biological systems.
Absolutely.
And that is what functional medicine is so unique at diagnosing and treating in a totally new way.
Absolutely. And so it's that constant work around the matrix. And one of the things that I said earlier is functional medicine is hard medicine. It's hard for the doctor. It's hard for the patient.
Yeah, because you have to think.
Right. And you're constantly thinking. And as you treat, the environment of the patient changes. So you begin the treatment plan, and the patient comes back with a particular response. And that response will be based on what is their lifestyle, what part of the lifestyle have they been able to change? Because it's a real struggle for people to change lifestyle. That's hard work. And then, what are their genetics? And how are their genetics? Because we, use a lot of genetic testing here that help us identify that. And so once they come back and they've responded to our first step of treatment, then we go around the matrix again.
Yeah.
And we rebalance and we look, okay.
It's like tailoring. You adjust every time they come in.
It's like a fine watch, and you're just constantly working the gears, asking questions, having them tell their story again, retell their story. I can't tell you how many times I have sat in an hour and a half initial visit only to have the patient come back over Zoom or a physical visit to the office, and I ask them the same questions, and all of a sudden they're in a different place, and I get a different answer that opens up a whole new realm of thinking about their disease, their health, and even their goals for their life. So every time I go around the matrix, I get that person better and better and better.
So we don't treat 155,000 diseases. We just work with optimizing our biological systems in the matrix. That is the key to functional medicine. So that in a way, it's very simple, but it's also very unique because each patient's different. And for the patient, some of the changes are hard because we're asking people to change their diet or take different supplements. But the truth is that it's actually, ends so much suffering and helps them so much that people are so excited about it. They do it. And so it's actually, and many times, very easy for patients to change because they see the results so quickly.
Yeah.
So let's talk about the Sibo. Let's get back to Sibo and talk about this cases. I think we should share some cases.
We should,
Give an example of what we're talking about. Because it's sort of abstract.
I would say that very rarely do I see Sibo by itself. And why is that? Because Mark, you've already talked about it. It's the microbiome. Okay? When the microbiome is disordered, as it is in Sibo, and you have these bacteria growing where they shouldn't grow, and so you're now changing how food is processed, you are changing where it's processed, and you're changing the body's ability to absorb it. And what we know about the microbiome is those bacteria actually train our immune system. They're very closely related to our immune system, and our immune system identifies antigenic material from the bacteria, and the bacteria is able to tell the immune system, here's what you need to be worried about, here's what you don't need to be worried about.
Yeah.
Right. And so when we alter that gut immunity, we can create inflammation, and when we create inflammation, we begin to break down that membrane that's responsible for opening and closing and letting good compounds and good nutrients in and keeping the bad guys out.
Yeah.
When that breaks down, we have leaky gut. And now all of a sudden, our immune system starts to see proteins that have not been completely processed down to the peptide level that they're accustomed to, and they start making antibodies against commonly eaten foods.
Yeah.
So now this person with Sibo is sensitive to a plethora of foods that they eat every day, which they might not be allergic to those foods, but they're sensitive to them. So now they're not eating. So they're coming with all these symptoms. It gets exacerbated by almost everything they eat in their diet. And because now the disease
process. Or they're
process,
eating and they don't know what to do not eat because just everything bothers them.
Right. And so now they can come in that sick. Now that their immune system's triggered, they have muscle aches. They have joint pains. They have brain fog because now they're having
fatigue.
They have fatigue. Their mitochondria are being affected. Their brains are inflamed. They're being affected. So now this person comes in and they may say to me, I have brain fog. I have this, I have that. I get the whole story and I hear the gut. Always start in the gut, right? So now what do? When they tell me there's symptoms, we order a test. It's called a small intestinal.
Before you get into the test,
okay,
I just want to recap because what you said was so profound.
Yeah.
Which is that
I like being profound. Thank you.
No, I mean it's a total frame shift. So most doctors don't think much about the gut unless you have direct digestive symptoms, and even when you do, they treat it kind of in a very linear way. But what you're saying is when those bugs that should be in our large intestine migrate up to the small intestine for various reasons, it causes an imbalance in there, and that leads to a breakdown in the barrier, which causes this leaky gut. And then all these foreign proteins and bacterial components leak into the system. Your immune system goes, that's not me. And it starts creating a response. And then you get systemic inflammation, which is why you get brain fog and muscle aches and fatigue and joint pain, all these things, skin rashes, eczema, acne, whatever. And people think these are all not connected, but they are connected.
That's why Sibo is such a great topic to start with.
Yeah.
Because it connects the entire matrix.
So tell us how we test for it, and then let's get into a case.
Okay, so testing will be with a breath test. It's called the Sibo breath test, and we starve you for a day. Basically, we want to starve out those bacteria that are living in the small intestine so they become metabolically inactive. And then you wake up in the morning and you take some lactulose, which is
like a non-absorbed sugar.
Non-absorbed sugar. But before you do that, you breathe into a little balloon, and then we put that aside as your baseline test. Then you drink the sugar drink. And now the bacteria are like, we got some food. We're excited. We were starving out, thought we were doomed. And then they get very metabolically active. And then within 30 minutes or 60 minutes, when they're metabolically active, they start producing the exhaust of their metabolism. Hydrogen, and then sometimes methane, and even sometimes sulfur gases.
So it's not just the cows that are burping methane?
Nope.
Humans?
Nope. Yeah, Uncle Art's been belching
So if you have
methane.
Sibo, you're contributing to climate change. Is that it?
Yep. That was going to be when we get to the magic wand question. I'll talk about my wife. Anyhow, so
There's also other tests like urine tests. You can look at metabolites.
right. Yep. You can look at So. We can look at metabolites that will show us markers for dysbiosis in the gut using an organics test. So an organics test is when we look at all the organic acids that are products of your metabolism. And so we're able to we know what should be, in the metabolism appropriately. And we can look at organic acids, and we do that as a part of our GI workup.
Which is a test that traditional doctors don't do. They'll do the
Right.
traditional breath test,
Right.
but they're not going to do
Right.
an organic acid test.
Organic acid test or something even more advanced called an ion profile that looks at all of your amino acids. And that's important when I do a Sibo workup, because if I look at your amino acids and you're depleted, then I know you're really in trouble with your Sibo because you're not getting good
absorbing.
nutrition.
You're
not absorbing.
Yeah.
And then I can see markers of inflammation on the ion test.
Yeah.
I can also see the organic acids are really critical because there are things that the bacteria produce that will end up in our urine that indicate to us that, wow, those things are in the urine because you have bacteria overgrowing or don't belong in your gut.
Yeah.
And now we find out.
I think you're right. I'm going to jump in with a
Yeah.
case that just reminded me of a little girl I saw years ago who was 9 years old, and she was a pretty little sweet looking girl who was a monster, like a terror. She would constantly get kicked out of class. She literally couldn't make it home on the bus without the bus driver having to stop 10 times to settle her down. She was violent. She would rip, her pictures of a part of her family at home. She would terrorize her sister. And I'm like, what's going on with this girl?
Right.
And we did a whole workup, and we found her organic acid test. And we found she had massive levels of overgrowth of bacteria.
Yep.
And she had overgrowth of yeast, which is not called SIBO, but SIFO, or small intestinal fungal overgrowth. And what I did was I gave her an antibiotic and an antifungal. And literally the girl completely transformed. So you think you're treating a psychiatric disorder
Absolutely.
with antibiotics and antifungals. How does that make sense? Well,
Right.
it makes sense when you understand the connections between the gut and the brain. I mean, this was over 10 years ago, and I remember writing about it in the Ultramind Solution because I was like, wow, the gut is so connected. I had another one with OCD, the same thing. She had high levels of ammonia, and she had severe OCD. She wouldn't pick up anything off the floor. I gave her an antibiotic, and literally she became like a neat freak. It was the weirdest thing.
Oh yeah, no. In those cases, in the cases I've seen, SIBO is very commonly related to neuropsychiatric disorders. So when I have people with memory loss, brain fog, ADHD, just as you've said, I've had multiple patients of mine, right?
Depression.
Autism. The first thing we do is treat their SIBO, change their diet, and within the first 6 weeks, we're starting to see significant change in their behaviors with ADHD and in their verbal abilities with autism kids.
Tell us the case.
I was going to talk about a fibromyalgia case, but I will talk about a ADHD. I had actually an anxiety depression case.
Talk about both of them.
Yeah, I'll talk about them all. There's so many cases I could choose from. There is a recent case from a patient from a different part of the world actually came in, and they were having lots of difficulties with their child, very bright siblings, but this particular child was having lots of issues with impulsive behavior, attention in the classroom, moodiness, to the point where the child would speak of not wanting to live anymore. And so I went through all of their symptoms, and the biggest thing that this child had difficulty with was the bloating and the distension. That was constant. Mom noticed it from almost day one of life. So we did not only the Sibo breath test, but we did something called a GI map test, which will look at, it will using DNA and PCR technology, look at all of the bacteria in your gut, the major colonies, the major species, look for Candida, and then also look for markers of inflammation. Those two tests on this patient indicated severe disruption of the balance of the microbiome. The patient was put on a brief elemental diet, which is a diet that takes out, most foods,
All the foreign proteins,
and then was put on a autoimmune paleo diet, and very difficult to put a kid on a diet
Which
like
basically
this.
starves a lot of the bad bacteria. So instead
Absolutely.
of feeding them with all the starch and sugar and carbs, which they love, you're giving them less of that.
And we combined it with a low FODMAP diet to make sure that the child got all the nutrition they needed.
FODMAP is like what? That's like...
So those are long chain sugars that get fermented very quickly by bacteria, and when you eat them and you have small intestinal bacterial overgrowth,
You get a very big food baby. You're like 9 months pregnant.
Right, and the food baby is this, basically. You're fermenting food where you shouldn't be. Food's meant to be fermented in the large intestine, and that's like Florida. Right. But, what's happening with small intestinal bacterial overgrowth, the bacteria are up in Maine, and the food's coming into Maine. Maine's not ready for gas. So now, all of a sudden, you've got this gas where it doesn't belong geographically. You feel very uncomfortable. And it starts to impact everything we talked about. Your nutrition, your inflammation, and that translates to that gut-brain connection. The brain gets affected. That's why we see so much benefit when we treat diseases like Sibo and dysbiosis in our patients with neuropsychiatric disorders, from ADHD to OCD to anxiety and depression. And you've noticed it. I know we've talked about even like Parkinson's and other disease processes that will stabilize once we start addressing gut issues.
So what happened to this kid then?
So when we had the 6-week follow-up, and we had started, it was actually not the 6-week follow-up, but the 6-week follow-up, we went over all the testing, and we started the second part of the nutrition plan. Once we started the nutrition plan, and I used some natural herbs to get rid of some of that overgrowth.
So sort of antibacterial herbs.
Antibacterial herbs that come in different compounds that we use. At the 8 weeks later, that child's behavior, the mood swings were completely gone.
Yeah.
Completely gone. The impulsivity was drastically reduced, and the teachers were saying he was now paying attention in class. And that was just with food. No stimulants.
That's remarkable.
No stimulants.
It's just herbs like oregano and berberine and thyme and things like that.
Absolutely.
Yeah, powerful stuff.
Yeah, and so that's the Sibo story.
Yeah,
it's that gut-brain connection. It's so powerful.
Brought back some bad memories because we talk about the food baby. When I got sick from mercury poisoning almost 30 years ago, one of the things mercury does is it interrupts all your enzymes and your function. So my gut became very dysfunctional. And I remember literally having food babies all the time. I literally almost couldn't eat anything without my stomach blowing up and feeling like someone just pumped my intestines up like a bicycle tire.
Yeah.
And at that point in time, we didn't really think about Sibo. We didn't really name it. And we weren't really aggressively treating it. I was trying things that I thought would work. But it was really tough until I got rid of the mercury. I couldn't get rid of the Sibo.
Yeah.
So often there's something underlying it, right? There's often a root cause.
Yeah.
I've seen people with gut issues that maybe were caused by Babesia, for example, which is a tick infection.
Oh, absolutely. So Lyme
which
disease
can paralyze the gut.
Right. So if I have a Sibo patient that's not getting better, I think two things. One is I think about Lyme disease, because if one of the symptoms of Lyme disease, and is a trigger to test somebody for Lyme, is when they get Bell's palsy. Lyme disease can affect the nervous system.
Yeah.
And so Bell's palsy is when you have your facial nerve is paralyzed, and it can be caused by Lyme.
Yeah.
The same thing can happen in the gut. You can get a paralysis and a dysfunction of the migrating motor complexes, and now the peristalsis of the intestine is declining. The intestine won't move. Now these bacteria can stay there and populate.
Yeah.
So again, it's all these things.
And that's
that
the
can
thing,
impact it.
when you go to a traditional gastroenterologist, you might say, okay, we do the breath test, you have Sibo, take these antibiotics, forget about the yeast stuff. And like, I'll see and hope cross your fingers. And there's so many times it fails because they're not getting the root cause. So the root cause may not be Sibo, it might be something that's causing the Sibo, like Lyme or like mercury or something else.
And there's something else too, going back to lifestyle. When I can't get a person better with Sibo, and I start going around the matrix again, are you sleeping? Are you exercising? How's your marriage? How's your relationship? Do you have a toxic relationship? Because the people that I've done everything for, I've given them bone broth and colostrum and elemental diets. They're not getting better. It's the 5th R. We use the 5 R's, right? We use remove, repair, restore, and I can't remember 4.
It's remove, replace, reinoculate, repair,
rebalance.
And rebalance.
And the rebalance piece, the 5th R. I call it 5th R. It's the 5th R. It's getting people to rebalance their lives. And that is basically, are you dealing with your stress? The people that aren't dealing with their stress, aren't getting their sleep, aren't exercising.
And what does stress have to do with your intestines?
That's another podcast.
Come on.
Yeah.
Give us a nugget here.
Okay. So stress. So stress is probably the start of all disease. It impacts everything from your hormones in your own body, but stress actually creates some neurochemical changes in your brain, and there's a communication between your brain and your gut microbiome.
And your gut, it's called the second brain.
It's the second brain.
Right.
Well, some people think the gut was the first brain.
Maybe.
Right. And that our brain only developed once mitochondria. We're starting to make energy for us. And then we're able to use that energy to make a second brain that allowed us to reason and so forth. However, once you have that gut-brain connection, stress can actually, we have this vagus nerve. It's a superhighway from the gut to the brain. And
it's the relaxation nerve.
It's the relaxation nerve. And your brain can communicate anxiety and stress to your gut microbiome and actually change the makeup of your gut microbiome.
Yeah, and your nervous system.
Right,
your
and
gut.
your nervous
system. And it literally paralyzes, stress hormones literally paralyze your gut. Your sympathetic nervous system and your fight or flight. You don't want to be digesting your food when you're running from a tiger. Right. You want your gut to shut down so you don't have to poop or do anything else. Right. So your gut shuts down. And that's what happens. We live in a state of chronic stress and our gut's not working.
It's not working. And then you end up with, now you create that environment for Sibo to develop.
Yeah. I just, was talking about Sibo. I just remember this patient I had a few weeks ago was what a striking case. She came in with what we call vestibular migraines, which is essentially a migraine from hell, where your room is spinning around, you're in bed, you're nauseous, you can't get up. And she had it like 25 days a month. And she was a really smart young woman who, wanted to go to graduate school and was basically in bed. And so I started not just asking about her headaches, and she'd seen like 45 doctors and, seen neurologists and everybody, and she was on this medication, nothing was working. So I'm like, what else is going on? Well, I bloated all the time, and my belly's distended. And I could see she was puffy and swollen. She gained a bunch of weight. She was severely depressed. She was anxious. And I'm like, this is not a messed up person. This is a person whose biology is messed up. And I said, well, let's just try to put you on a clean diet, eliminate all the allergic foods. I gave her a non-absorbed antibiotic and an antifungal. Basic nutrients, very simple. And I waited for a test to come back. And she came back in. Now, the first time she came in, she had to leave the door open. She was so anxious. Her system was so in fight or flight. She couldn't even be in the room. She stood up. She was pacing around. I'd never had a patient like that. She came back 6 weeks later. She looked like a different person. I mean, not only was all the inflammation gone out of her body, all the fluid, not only did she lose 20 pounds, but her gut was normal, and she hadn't had a migraine.
Right.
She was completely better. She maybe had one or two very mild headaches. And when I got her test back, yes, she had Sibo, and I sort of could anticipate based on her history what was going on. But that's a case where, she had been seeing doctor after doctor after doctor. And these are the kinds of patients we see here, where I often joke, because we've been here for about 15 years. Before that, I worked at Kenya Ranch, was the medical director. And I always joke I was a resort doctor, the doctor of last resort. And that's the kind of patients we see here. Or I joke I'm a holistic doctor because they take care of people with a whole list of patients, a whole list of problems.
Right.
So, the treatment for this is all the things you mentioned. It's diet.
Right. We start with diet. It's really diet and lifestyle. By the time patients get to me, as I said before, Sibo is just part of the whole complex, because once you've affected diet, then you're affecting how your hormones are working, your autoimmunity, and so forth. So we always start with diet because we can impact all the systems with a good diet.
We had a visit from some friends of ours who ended up staying with us, and we had known them for years, but they'd never stayed with us, and we've always known them through sort of the sustainability work, right? So I had been doing environmental health. My husband is in public policy around renewable energy. So we knew them through work circles. And anyways, we were hosting them for a weekend, and they come. We knew that the wife, Pia, was also clairvoyant. So she was a sustainable architect, and her husband was one of the leading climate physicists. So there was
That's
this
a
very
handy skill to have.
Exactly. So they're a very dynamic couple. We knew about her clairvoyance through sort of hearsay, but we had never experienced it up front, and kind of never really were curious enough to go there.
Woo-woo.
Oh yeah, exactly. That's how I felt.
Yeah.
So they ended up staying in our house. And one of the things was that my younger daughter was having night terrors and for 4 months, which did not bode well for my insomnia. And we had tried everything. I mean, and actually gone out kind of on an alternative limb too, right? She was doing like chamomile drops and, some homeopathy, but nothing really touched her. And so Pia walks into her house and she starts coughing. And she said, there's something going on. The energy in this house is really heavy. Do you guys feel it? And we were all looking at each other like, okay, woo-hoo,
Right.
And she said, well, but it's really heavy. And so she said, okay, do you mind if I just walk around? So she's walking around and she said it's heaviest in the girls' room. And so, nothing opens your mind like desperation, right? So,
sure, right.
So
that's why I say people only change when they have, when they don't have NEP syndrome anymore. NEP syndrome is not enough pain.
Yes.
When people have enough pain, they're going to do whatever.
Right. And you hit that dead end, right? So I said, you know what? Maybe it's heavy because Sonia, my daughter's been crying every single night, right? And she said, well, wait a minute. She said, no, it's the other way around. Sonia's crying because she feels the heaviness too. And I'm like, okay, whatever. So she goes off to Whole Foods, of all places, gets a sage wand, right, with a smudge stick, which I had never heard of before. Yeah.
It's a Native American way of clearing energy from a room.
Exactly. So she just goes around and she said, well, it's really important that you come with me. You're the lady of the house and your intention really matters. And I'm like, but my intention is I don't actually believe what you're doing. She said, no, just say whatever doesn't belong here needs to leave. And the thing that really convinced me to do it with her was, well, first of all, it was low risk. I mean, there was, right, I'm always looking for high potential gain, low risk.
Little sage around the room.
Exactly. Never hurt anyone. But
bad stuff, get out.
She said that she had a vision. And she described this vision of this man, tall, slender, reddish brown hair, balding right here, wearing a plaid shirt. And it sent chills down just throughout my body because this was the seller of the house who we'd met 3 times, like to a T.
Wow.
And so she said,
had died.
He had not died. He had moved out, but he had not wanted to move out. Oh. And she said, that's just what keeps coming to me when I look at the energy. And I was like, okay, whoa, weird, but okay. Like that's really spot on.
Yeah.
So we just walked around and, and I was kind of just being very sympathetic too. I sympathized with the seller, right? That he had to leave his home.
Yeah.
So, but I wasn't holding my breath. And from that night on, Sonia slept soundly.
Amazing.
I mean, to this day, she's an incredible sleeper. So, and then there was still part of me who was like, well, there's no control. How do we really know? Maybe it was coincidental. But before Pia left, what she did was she said, I actually approached her and I said, well, if you can lift the heaviness in a house, can you lift
What's wrong with me?
Can you lift the heaviness in my body? I'm much smaller than this house. And she said, oh, it doesn't work quite like that. And she said, but I can do one thing. I can teach you how to develop intuition, which I had never heard of. I did not know that intuition was something like music or art, like you can develop
practice it.
Yeah, you can practice it. And she was very pragmatic about it. And she said, no, this doesn't mean you're going to be clairvoyant, right? But it just means that you can learn to open this other side of your brain that has probably been closed off for a long time because of your training and your upbringing. So so she taught me how to do that. She taught me what I needed to do to begin to practice to open up to that. And a lot of it was so basic. A lot of it was just silencing my analytical mind and being in my body. And that second part was the hard. Well, actually, they were both really hard. Yeah. Silence the analytical mind, being in my body, because my body was so uncomfortable.
Yeah.
And so she said, you can only heal something that you are connected to. You can't heal something you're detached from. So that was healing on multiple levels, both that I had to inhabit my body, which was probably one of the biggest steps in terms of healing, not being afraid of it, but going into it. And then also learning how to read sensations as messages and not just symptoms that were making me miserable.
I always say the smartest doctor in the room is your own body if you listen to it.
Absolutely. So the intuition piece came in incredibly handy when I was introduced to functional medicine. I wasn't really practicing it because I was doing steadily better. And then
were you trying some of it on yourself?
I was trying some of it on myself, but like it was, you know how it is when you're like, it's like, someone wants you to play a piano piece. You can't even read the notes yet. And it's laborious. So I wasn't motivated. But then I go to the intro to functional medicine conference and saw all these tools, but then felt overwhelmed. And then I was motivated to practice intuition. And I really learned to use intuition to guide me. Like, how do I choose what to do next? Is this the right diet for me? Is gluten really, is it something that I can return to, or is it something that I really need to stay off of strictly? So it made that navigation much easier for me. And it's something that I encourage my patients to, to develop if they're interested. It's simple. It just takes a lot of repetition and quiet listening.
So you found, one of the causes was gluten, right? And toxins you got from China that you worked on getting rid of.
Right.
Was there anything else?
So I did a lot of detoxes. I learned how to balance my hormones. I think my hormones were really out of whack after that incident.
What does that mean?
Well, my estrogen and progesterone levels were really low. So for a while, I actually took bioidentical hormones to just support my system so I could get strong enough just to help balance out the immune system. And then as my whole system got stronger, I was able to really wean off of those. And just last year, even like 14 years later, I actually completely tapered off my thyroid medicine as well.
Wow.
So I didn't know that was possible.
Yeah. Amazing what happens when you learn how to take care of your body.
Amazing. Yeah.
Yeah.
Really
so functional medicine is an incredible roadmap. It's really about thinking differently about disease. And it's what you said, it's about understanding the body as a system where everything's connected, where there are root causes of things that we can get to, where there's things your body needs like rhythm or the right food to help it restore balance. And when you do that for yourself, it works. And often, it's not something you even have to do in a doctor's office. A lot of things that actually work to create balance are things that everybody can do, whether it's eating well, moving, sleeping,
absolutely,
meditating, connecting, being in a social support system. And then sometimes you do need help to get rid of some of the drivers, things like heavy metals or infections like Lyme, which you said you had, or mold, which I had and almost died from a couple of years ago. Allergens, those are the things that actually, you might need a little help with. But if you're suffering out there, if you're listening and you're wondering, what's the road? How do I get better? I've been told that this is just something I have to live with, that I have to manage, that I have to take medications for. I encourage you to just have hope, because if you are suffering, there is a road for most people to recover. And functional medicine is the GPS system to figure out how to navigate that road. Yes. And it really is a powerful model. It's not the answer to everything, but it is a far better mousetrap than we were trained with in conventional medicine. And it's what I've done for the last 25 years. It clearly is what helped you recover. It helped me recover. And I wouldn't be able to do what I'm doing if I didn't actually understand the body in that way. And every day, I remember first practicing functional medicine. I wasn't like for you, but I was like, I would tell people to do this stuff that was sort of outside the box of what I learned in medical school. And they'd have severe migraines, 25 times a month, or they'd be having severe irritable bowel, or they'd have, an autoimmune disease. And I would tell them to do, change your diet, do this, do that. And they'd call me back 6 weeks later or whatever. And they're like, I'm better. And I'm like, you are? Really?
I say the same.
I'm like, what? That worked? Okay, fine. It was like, I really took me years and years to expect that people would get better, because I was like, well, I don't know what I'm doing. I'm just going to try this stuff. And it seems to make sense. And it's not going to hurt them.
Right.
And people just recovered, and it just was amazing to me.
Yes.
I mean, I had a woman the other day who came in with vestibular migraines, which is a terrible kind of migraine where your head is spinning, you're in vertigo. It's like you were saying you experienced.
Yeah.
She had severe migraines 25 times a month. She had severe other, quote, other symptoms. So she was seeing the neurologist for that, but they weren't worrying about her gut. And she was having severe bloating, fluid retention, digestive issues. She had anxiety. I mean, she couldn't even come in my office without the door being open.
Wow.
And she was a really smart young woman who wanted to go to be a nurse practitioner, and she was a nurse. And it wasn't in her head. And she was on all these antidepressants and psychiatric medications and anti-anxiety medications and vertigo medications and migraine medications. You know the drill. And I'm like, well.
And then medications to counter those side effects of those medications.
Right. And so, I just followed the basic map of how do you help people restore health and function. And for her, I was like, well, she's got a lot of inflammation going on. I could see her. She was swollen. She had fluid retention. She had gained a bunch of weight. And, I wasn't treating her migraine. I was helping restore her gut function.
Yes.
And I was helping her, eat a diet that was anti-inflammatory. And I was helping her with certain nutrients she was low in. And, I never really had a patient like this before, that was that severe, that had vestibular migraines. And in functional medicine, it doesn't matter if you've never seen the disease before, because if you follow the principles of removing the stuff that's causing a problem and adding in the stuff that creates health, the body knows what to do. It's super smart. It's
right. The body figures it out.
Yeah.
Right. We don't have to.
No. And so I just, fixed her gut. She had really bad, I gave her stuff to clear out, Sibo. She had bacterial overgrowth. She had like fungal overgrowth in her gut. So I cleared all that out. I restored her gut with a gut health shake, which contained, polyphenols from cranberry and pomegranate and green tea, and gave her probiotics and prebiotics and, just fiber and things to help her gut. A few basic nutrients, got her, on an anti-inflammatory, gluten, dairy-free diet. She came back 6 weeks later. I didn't recognize her. I mean,
wow.
All the fluid went out of her body. She was bright and alert. She was funny and had not had a migraine and was, symptom free. Her gut was completely better, and she was off the medication.
That's amazing.
That just
but I don't
never
want to
happens
discount
in
also
tradition.
the fact that you acknowledged her and validated her,
Yeah.
right? I mean, which is a huge piece of
I'm like,
healing.
you're not crazy.
You
And,
saw her,
Yeah,
right.
I saw her, right? I mean, she was in bed, and I could tell she wasn't a malingerer, she wasn't a whiner.
Right.
But it's easy to dismiss these patients and go, well, it's just, they're just psychological, whatever. Just give them some meds and kick them on their way.
Right, but then they're psychological because they feel miserable, right?
Right. Well, that's very important.
I mean, right. I'm like, wait a minute. Like, okay,
If
we
your
call
body
these
isn't
things,
working,
it's like,
your brain isn't
right.
gonna
The difficult patients are the
Right.
ones who are really suffering, right? That's
Yeah.
why they keep coming back. That's why they're irritable. That's why.
And your
So,
doctors called you a difficult patient.
Yeah, I mean, I called myself a difficult patient. And,
You want to be a difficult patient.
But it's the difficult, right? It's the difficult relationships that force us to grow. I mean, we have to start asking the question, like, wait a minute. And I would say it's like any other relationship, right? Even if one person is the one who's sort of being dismissed and is kind of miserable, I mean, both people in the relationship know something's not working.
Yeah, that's right.
So even before I got sick, I knew that the tools that I had in my doctor's bag were really limited. I already knew that, but that's kind of the best I could do.
Yeah, but you didn't know what else was out there.
Right.
And I think,
exactly.
you and I both had the experience of being knocked to our knees in order to figure out a different way. I don't wish that on all our medical colleagues.
No.
But I do wish they would understand that the paradigm that we learned is only part of the story.
Yes.
And that, everything I learned in medical school is useful, and I use it and I rely on it. But there's another meta layer of understanding how the body is organized, because those are just the piece parts. Like, what does the puzzle look like when you put it together? That's what functional medicine is. And it's such a powerful model. It's what we do at the Ultra Wellness Center in Lenox. I have 3 other doctors, 2 PAs, 5 nutritionists, and we work with people from all over the world. We've probably over 70 years of clinical experience together. And it's just amazing the kinds of things that people can recover from. And now you're doing that in your own practice. You've written this great book, Brave New Medicine, which is a really fabulous story about how you as a physician understood that there's a different way to heal your illnesses and your autoimmune disease and all this weird nonsense that we don't know how to deal with in medicine.
Right. And sort of just what does it look like, the lived experience? To your point, though, I mean, I right at the end of my book about this essay, this famous essay called Arrogance, back in, I think it was 1980, in the New England Journal of Medicine editor at that time, or he had been retired, Inglefinger. He was dying from cancer and had written this very provocative essay where, I mean, he was talking about arrogance at the time, and I would say arrogance is probably not the vice of today. I think it's more just not seeing, right? Not seeing, or denial.
It's a little bit of hubris, a little bit of denial.
Right. And he had posed the question, what would medicine look like if one of the prerequisites for all doctors entering medical school was that they had a serious illness?
Yeah.
Like, what would it look like, right?
Yeah.
And so, yeah, would there be more empathy? Would there be more belief? I mean, like this one of the central questions in my life has always been around belief.
Yeah.
Right? Like, what is true and what is not true? How do we make ourselves believe things if we don't?
Yeah.
And yeah, and like, how do we start with that? Like, as a doctor, like just believing all patients. And
that's really important because, as physicians, we were subliminally trained to have a dismissive attitude to many categories of patients. If you had irritable bowel, well, that was in your head. Or if you had chronic fatigue or fibromyalgia, or if you had, even more serious illnesses like Crohn's or colitis, well, that was psychological. Yeah, it manifested physically, but these were trouble patients.
Right. I mean, which is so ironic and unfortunate. I mean, for everyone. I mean, like, I know for myself and many of my colleagues and friends that I know went into medicine to alleviate suffering. Mm-hmm. Yeah. And, how much of it are we perpetuating? And, one of the themes also that that comes up over and over again with chronic illness, and I know for myself too, is, reaching that point of hopelessness or helplessness. Yeah. And there becomes a learned helplessness on top of that when you get punted from doctor to doctor to doctor. Right. So are we perpetuating illness as well through this system? And, would I want doctors to go through this? I mean, hell no. Mm-mm. But, so I sort of turn that question on its head. Like, what would medicine look like if doctors, nurses, healthcare practitioners had an immersion in wellness?
Yeah.
Like, what if doctors, right, were taught to sleep well? What if doctors were fed well in their training? What if doctors, I'm serious.
God,
like,
it's so terrible.
What would it look like? What would medicine look like if we could experience?
Sleep and lunch are considered weaknesses in residency training.
I know that. And, but would we have that experience then to be able to translate to our patients, right? I mean, we're ultimately teachers.
Well, that's what functional medicine is. It's a science of creating health.
Yes.
And when you do that, disease goes away as a side effect.
Yes.
And you're right. I think, if you look at most healing traditions, a lot of shamans or healers went through some crisis, some health crisis, some trauma, something.
Some initiatory illness,
that was sort of help, sort of select them to be healers. Mm-hmm, mm-hmm. We don't do that anymore. We just have the hazing of medical school. But that makes us all kind of unwell in a way, and we sort of then normalize that.
Absolutely.
Yeah.
Yeah. And then we sort of pass it on, right? It's a kind of trauma.
It is.
It's a kind of trauma, and then we pass it on to our patients inadvertently. So how do we break that cycle? And, I would say one thing, though, just to bring up related to that in terms of my healing, was it was hard for me. I mean, even when I found functional medicine, I just had such little energy that it was easy still for me to have I called it hope fatigue, right? To try another thing, to try again. Yeah. And what I ended up discovering that was easier was to release. So instead of sort of going, trying to think positively, trying to be optimistic, which were things that,
you kind of have to surrender to it.
Absolutely. I mean, because those qualities feel like sunlight to someone who's suffering from a migraine, right? Like, I know I need that sunlight, but it is killing me right now.
Yeah.
My husband was this sort of embodiment of resilience and confidence and optimism. I couldn't stand to be around him. It was stressful. up from where I was. And so what I ended up stumbling across was, oh my God, like I'm carrying around a lot of grief. Okay, yes, I've got, my lost identities and time lost and all this suffering, but like, all this stuff came out, right? I went to a grief ritual. I didn't know these things existed, but back generations ago in cultures, those are like soul detoxes. Yeah. Right? Like, how do we do that?
That's right.
Like,
it's not a body. I love that soul detox.
How much are we carrying that is subconsciously programmed into the way our DNA folds, into the way our neurons are wired. And so, and grief is non-discriminate. So like, I thought I was going for my health, just the loss of the function of my body. Yeah. And all this stuff came out, cobwebs, right? Just, from childhood, from, residency, relationships in the past, and then the shame of having this mysterious illness, the shame of being a doctor who cannot figure it out. Yeah. And that was really, really healing. So then as you say, like as a side effect, what ends up filling up that space is health. Yeah. Right. It is, I suddenly become more optimistic. I have more hope because there's space for it. Yeah. It's not something that I have to will myself in order to get, because I couldn't do that.
That's amazing. Yeah. And so you've taken all you've learned. You've been through, so many different cycles of struggle, and you've recovered and come back on top, and you've written this book. And what's beautiful is, it's really your story, but it's an inspiring story, and it's sort of a window into both sort of how in traditional medicine we kind of miss the boat a lot of times, and how you can on your own become empowered to sort of find a brave new medicine. Mm-hmm. But you also share at the end of the book, 15 steps that are about healing, about how to care for your body and how to heal. So in a way, you sort of make it really simple for people in how to actually create health for themselves. Can you take us through those?
Yeah. So, a lot of the steps were ones that we covered. And so the way that I sort of live through the experience of my healing journey is, was really through the journal that I kept. And the journal was something that I'd kept since I was a little girl. And so when I sort of made that shift, like, I've got to try differently, go back to Pathology 101, review inflammation. Okay, what's my first step? Like, this is going to be my experiment. I'm an N of one. I'm my own doctor. I'm my own patient. Life is the experiment. Step number one, ask new questions. And so then, number two, I think, was the resetting my inner clock, right? Number three. So I kind of, I just build it stepwise as I'm living through my healing journey. So it's a how-to, but it's sort of
But it's really organic. Detailed. It's really beautiful. It's simple. Like, how do you set your rhythm? How do you sleep?
Yes.
How do you give yourself permission to receive and have people help you, right?
Right. Which was, was really challenging. Yeah. Because, I stopped driving for quite a while. And most people were just like, oh my God, that's just horrible. Like, how do you you can't even get around. And you know what? I started thinking about, like, who can I carpool with? Yeah. Who can get a ride? It ended up being a strange community building experience. And
we can do it ourselves. I can do it myself.
Right. And then I realized also, I don't have to live my life so fast, right? Mm-hmm. I can slow things down. I can wait for a carpool. So there's a lot of things I think that happen with healing. Like, for instance, a diet. I might prescribe a diet that's healing for myself or my family or my patients. And maybe it's less about the diet per se than just getting them to connect to their food. Right. Getting them to connect to their bodies, and they're paying attention. And they're treating themselves with love. Like, so how much is that? Right.
Beautiful. Get a daily dose of nature, detoxify your house and yourself. And it's really well laid out and very simple. It's almost like you've taken all the concepts of functional medicine and traditional Chinese medicine and everything you know about healing and integrative medicine, put it into really very practical, simple things. And some of them are kind of strange, like let your intuition tell your thinking mind where to look next, right? So
now that's a quote that I took from Jonas Salk, right? One of the inventor of one of the polio vaccines. Yeah. And that was another thing that was sort of reassuring to me when sometimes when I thought, well, I'm getting too woo-woo out there. But really looking at scientists, forefathers of modern medicine who were, they let their intuition sort of guide their discoveries. Yep. So I was like, oh, again,
like
it's not woo-woo. Why are we calling it woo-woo? It's actually very human.
Yeah, it's
We've
so
just
true.
forgotten it in our culture.
And there's so many other great things here, like heal your gut and the basics of a 30-day diet reset, which is super important because diet drives so much disease, as people know.
Yes.
And breaking old habits and just having pleasure and looking for root causes. I mean, surviving love and loss, really, really fantastic. Claiming your purpose, finding your story. I mean, these are just real nuggets of wisdom around healing that you've really come to the hard way.
Yes.
And
practicing pleasure is my favorite prescription.
Yeah, that's a good.
It's amazing how many patients won't do that unless a doctor prescribes it to them.
Yeah, it's really true. I think we don't prioritize fun and play and joy, and it's so great. Well, you just have shared such a wonderful story about how sick you could be, how sick we get, and how much illness there is, and your own road out of it. I think is inspiring for so many people, and I think I really feel like that's really why you do what you do. It's why I do what I do. It's why we spend time teaching and sharing, because there are so many people who suffer unnecessarily, who suffer needlessly, and there is a way forward. Well, let's talk about stress for a minute, because my thinking about stress is it sort of sets the table for other things to sort of take over. So
it doesn't cause
not
things.
In and of itself. It may cause some illness for some people, but it for the most time it exacerbates whatever's going on. So if you're stressed, your immune system's suppressed, you're going to get more inflammation.
Yep.
And then if you have underlying issues like this woman did, they're going to come out.
Absolutely.
So tell us how you approach this from a functional medicine perspective. How do we think about autoimmune disease in general from a functional medicine perspective, and lupus in particular?
Well, when I see a patient who has lupus, I go down sort of the checklist. So I look at, do they have sensitivity to gluten? The other thing which I find in a lot of lupus patients is Epstein-Barr virus. So Epstein-Barr virus is the virus that causes mono. And mono stands for mononucleosis because the virus infects your white blood cells. And the thing about Epstein-Barr virus is it's very common. About 70, 80% of the population has it. And most of the time, the immune system will clear it. And it's a herpes class virus, just like a cold sore. And once you get a herpes cold sore, that virus stays in your body all the time. Most of the time, the immune system keeps it in check. But there are certain individuals where the virus will reactivate and the herpes virus will come out, or the mono can actually reactivate.
So a cold sore in your lip is basically a herpes virus.
Herpes
and
virus.
It doesn't come out all the time. It comes out under stress.
Under stress.
Cold weather, emotional stress.
Too much sunlight.
Getting a cold, sunlight. So it's sort of a latent virus. We all live with hundreds of viruses in us.
Yep.
When we're stressed, it allows those viruses to emerge.
Exactly.
Right? And so this is what happened with this patient.
Yeah, and so I always like to go down and ask the question. So why is this? Why do women have lupus more than men?
Well, that's functional medicine. Why?
Right, and then interestingly, when you go into the medical literature in autoimmunity related to lupus, the Epstein-Barr virus is associated with 7 different autoimmune conditions: multiple sclerosis, rheumatoid arthritis, lupus, type 1 diabetes, ulcerative colitis. So what happens is the virus, in some cases, patients will reactivate, and it causes a stimulation of the immune system, and then the immune system will then start reacting to it. And then interestingly, I've always been curious about photosensitivity. Like why does photosensitivity happen in patients who have lupus? What's going on there? Why is that when they get sunlight, is it affecting them? And what I found out in the literature is that the virus causes the body to produce more interferon gamma. And interferon gamma is our body's one of the cytokines that help our bodies to fight off viruses. And when we have high levels of this interferon gamma, it sensitizes the body to sunlight. So that's why you get that sort of lupus-like photosensitivity, especially with exposure to sunlight.
And interferon is one of the treatments we're looking at for fighting
Yes.
COVID-19.
So what they do is they have an overabundance, and it may be a genetic predisposition. There may be some single nucleotide polymorphisms that certain lupus patients have, and they produce lots of interferon gamma, and that actually gets involved in the skin cells, and it can make them more photosensitive. So it's an interesting phenomenon. And then the other thing about and I've seen this with a lot of regular mainstream doctors. They'll say, well, you can't really check for Epstein-Barr virus because everybody's, if the antibodies are positive, it just means that you've been exposed to it. Well, that's true. But if you actually do specific testing for Epstein-Barr virus, so there's a panel that we do which checks for antibodies to the nuclear antigen and the cytoplasmic antigen, and then also the early antigen. And then I'll also throw in the Epstein-Barr virus by PCR. So PCR is checking for the DNA of the virus.
So you're actually seeing if there's live virus around circulating in your blood, not just your immune response.
Exactly. So typically in the panel that we use, if you have the 3 out of 4 antibodies that are positive, especially with the early antigen and or with the PCR of the Epstein-Barr virus, proof positive that the Epstein-Barr virus is reactive. Exactly, reactive. And that's where then you have to ask yourself, well, what do I do to calm down that particular virus? So there's a lot of things that you have to look at.
That's true. Functional medicine really has a different perspective, and that's why we see so many patients here at the Ultra Wellness Center who've tried so many things and then they get better because we look at all the factors. So when I think of an autoimmune patient or just any disease in general, there are really only 5 main triggers. It's a toxin. So I've had patients with lupus have autoimmune disease triggered by heavy metals, for example. Could be
mercury,
an infection like lupus, or it could be the microbiome changes.
Yes,
it could be an allergen, something they're eating, like gluten.
Yep.
And it could be poor diet, which is inflammatory and has, for example, a lot of the emulsifiers in our food, like carrageenan and all these gums.
Yes.
They cause leaky gut, driving inflammation. And it also can be stress, like you said. And often it's many of those things together.
Exactly. Yeah.
So for her, it was a few of those things. For her, it was stress and the virus, and also her gut was a mess too.
Yes, her gut was a mess. Yeah. So the other thing that she noticed is that if she ate foods that were high in lectins, things like the nightshade family, that her symptoms actually got worse. And there's some of the work by Peter D'Adamo, who was the author of the blood type diet. He's the guru of lectins. And what we find is that in certain individuals, when you have high lectins in your diet, and these are compounds that are found in plants, which actually act as a defense mechanism for the plant, so that animals and insects are less likely to eat them. Lectins, there's in the medical literature a case study of a hospital that thought they would have a healthy eating day, so they served everybody red kidney beans in some type of a casserole or a soup. And then everybody got sick from it because it was very high in lectins, and it actually caused transient leaky gut. They had an immune response to the lectins in the plants. And I've had a number of patients, says not everybody will have that response to lectins.
There's a lot of promotion out there of lectin-free diets as the cure for everything.
Low lectins.
Yeah.
It's impossible to get
a low lectin diet. And I think it can be helpful for some specific patients.
Exactly.
I think the thing is that everybody finds the latest fad and think it's the cure for everything.
Exactly.
It's really not. And when you're in functional medicine, you get humbled by understanding how complex things are.
Absolutely.
How everybody's really different. How one person may tolerate gluten and another person may not. One person may be fine with lectins, another person may not. But if you have an autoimmune or inflammatory condition, it's something worth trying.
Absolutely, it is. And I'll interject here because this is an interesting finding. I stumbled upon this, and again, this was actually by Peter D'Adamo, who got me down this rabbit hole. Because I just recently had a patient who had 5 autoimmune conditions, including lupus, and I checked for a lab test called mannose binding lectin. You ever checked for it?
Actually, no, but I know about
it. Right. It's one of those things, and he's the one who got me to understand this. So mannose binding lectin is a compound that our body makes to bind mannose, and a lot of
that's a sugar.
It's a sugar. Mannose is a sugar. And what you find out is that people who have mannose binding lectin deficiency are at higher risk for lupus. And hers was undetectable.
Yeah, and I think the other thing I want to just point out is that, you're talking about this patient with lupus, and she had gluten, she had gut issues, she had stress, she had this virus, she had lectin sensitivity, but that was her. If you take 10 other patients with lupus,
they're all different.
The problem with traditional thinking is that everybody with lupus gets the same treatment. Once you make the diagnosis, you stop thinking.
Exactly.
And in functional medicine, when you have the diagnosis, that's when you start thinking. It's just the first step on solving the problem. It's like, okay, this is what your picture looks like. Okay, what are the potential factors that we need to think about to get to the root cause? And then we have to treat the cause, not the symptom.
Yes.
And that's the beauty of functional medicine. So for her, how did you treat the causes of her lupus and what happened?
Well, for her, it was really focusing on, she already actually was doing very well. I actually tested her, even though she said that she was eating a clean diet, I made sure. So she said she was avoiding gluten, avoiding dairy, avoiding lectins. And her testing was negative for any reactions to gluten. So I said, you're doing a good job, keep it up. It was negative for leaky gut. You're doing a great job, let's do that. But what I did do, and she had never had done, is she did tell me that she had a bad case of mono when she was a teenager. And my theory with her is that she probably, when she went under this very stressful time period, that the Epstein-Barr virus reactivated for whatever reason. And hers was, she had a positive PCR, so the DNA of the virus was floating around in her blood. And also she had positive antibodies. 3 out of 4 of her antibodies were positive. That was, to me, a smoking gun that her Epstein-Barr virus was really driving her lupus symptoms. So initially what I did is I treated her with some medicinal mushrooms, things like turkey tail. I used also lysine, which is an amino acid which can help. And I combined that also with some monolaurin.
Yeah, lysine is often something people take to prevent
herpes
outbreaks on their lip.
It works,
and it works incredibly well.
It works quite well.
Because it helps inactivate the virus. And other foods that contain arginine, like nuts, which are good for you, but in this case, they have high arginine levels that actually can activate the herpes virus.
Yes, and that's an interesting observation. But that was one of the ways in which I initially treated her. And she did get some improvement with that. And then another thing which I added to her regimen is low-dose naltrexone. And I'm sure you use that yourself. And I've been really amazed at
what is naltrexone?
So naltrexone, this is an interesting thing. So naltrexone is an opiate blocker. And I'm not sure how they actually stumbled upon this, but if somebody takes too much opiates and they overdose, you can give naltrexone to block the effect of the opiate.
Yeah, when someone has an overdose of heroin or narcotic, they give them Narcan, which is naltrexone, and that stops them from dying.
Exactly. And it's theorized that when you give naltrexone at very low doses, what you do is you block the body's own opioid receptors, and the body senses that, and it starts producing more natural feel-good molecules, endorphins. These are our own body's pharmacy for the pain molecules, which in turn modulates the immune system. So when you upregulate opioids, you're actually modulating the immune system. And I used to use it primarily in patients with ulcerative colitis and multiple sclerosis, but now I'm using it in a lot more patients. And I find that it works really quite well in a whole host of autoimmune conditions. So I used it in her.
And it's very low toxic.
It's probably
effects.
the safest thing. It's
very safe to use.
You can have a couple of side effects in a few people, but it's probably one of the safest medications that I prescribe. Absolutely, very, very. It has to be compounded, and you slowly work your way up on it.
What I experience with it is that it can help, but unless you deal with the root cause, again, it's a symptom manager, so it can help mitigate the symptoms, but it's not going to address the underlying biology.
Exactly. You're actually true. It's not going to reverse the condition, but it's one of those things where the risk benefit is so good that it's worth doing in a lot of patients. So I actually added that to her. And then we went to the next level, which is that we tried the natural route, and then she got some benefit, but it wasn't really where she wanted to. So I said, well, let's go ahead and we'll give her an antiviral. So I actually gave her some Valtrex at high dose. I gave it to her, I think, 3 times a day. I think you probably have done that yourself. High dose Valtrex for Epstein-Barr virus. There is no simple one-size-fits-all treatment for Epstein-Barr virus. I've learned that. There really isn't. And she actually responded remarkably well to that. Within a couple of months, she was like 80% better using the Valtrex. And I've had a few patients that was very, very...
I think that's right. I think, what's interesting, the more you do this, the more you'll realize, what works with one person may not work with another person. So another person have Epstein-Barr, you give them Valtrex, it may not do anything. And I think I've had the same experience. There's some patients you give them this relatively benign antiviral, like Valtrex, and it works well. Others don't respond to that. And I've had other patients use something called Valcyte, which is very expensive, has higher levels of toxicity, but it actually can be effective in select patients. But I think there's other therapies that she used, which are also important to mention because, as I've gotten more experience in this, I'm more interested in how do I activate the body's own healing systems? How do I use therapies that are regenerative? How do I use therapies that are facilitating the body's own ability to fight things? And she ended up using one of these therapies. So can you talk about that?
Sure, yeah. Well, before I actually talk about that, the other thing that also I've used in patients is intravenous vitamin C. Mm-hmm. And that's actually in the medical literature. High B vitamin C at fairly high doses, about 25 to 50 grams, has been shown to be very effective also for Epstein-Barr virus. So that's another thing. In her particular
But by the way, how does that work?
How does that work? At high levels, it actually works as a pro-oxidant.
So we think of vitamin C as an antioxidant, but actually it's working as a pro-oxidant.
Right,
So
which goes into the next her therapy, which is the therapy that
how does it do that? Do you want to explain how
it's a yin and a yang because there's reduction, which is the adding of electrons, and oxidation, which is the removing of electrons, and it has to do with coupling of the oxidative forces versus the reductive forces. So it's a little bit like a magnetic pull.
And at high doses, vitamin C increases the release of hydrogen peroxide from the white blood cells. So people don't understand this, but how does our white blood cell kill bugs?
We bleach them.
It produces bleach, hydrogen peroxide, and ozone, which are all oxidants.
Yes.
Right? So that's exactly how our bodies kill things. And it sometimes can't do the job, and using these other therapies, like high-dose vitamin C, can help actually increase the body's ability to kill infections.
Exactly.
And they've actually studied it in ICUs. They're using it in COVID-19.
You bring up a really interesting point, which is that there's a term in medicine called redox signaling molecules, and when you have these redox signaling molecules, which of ozone will be one, it actually upregulates your body's own reparative forces.
So talk about what she did with ozone.
Yeah, ozone was a game changer for her. She ended up using ozone, and she said it was like a game changer for her, which is really interesting because it was the first time I had a patient who had lupus who responded to ozone in that way, and was really quite amazing.
So how did she get the ozone?
She got it. It was administered by a local a physician who she was seeing, because she was seeing me in consultation, and she actually got it rectally and intravaginally.
So not even intravenously.
She didn't even get it intravenously, and she had that response. It was really quite...
You can give it intravenously, you can give it in the muscle, you can give it rectally, vaginally.
Yeah.
It gets absorbed, and it can be very, very effective. And rectal and vaginal treatments you can do at home, and you don't even need a doctor to order it.
Yeah, I mean, it's oxygen on steroids. That's really what it is.
It's high-dose oxygen with a little bit of ozone.
Right, so if you ever go out after a thunderstorm and you get that nice clean smell afterwards, that's ozone in the air.
Yeah.
That's the lightning producing ozone.
Yes.
It's a special species of reactive species of oxygen.
And it's one of those oxidative therapies, just like vitamin C, that it gives you a little bit of a stress, but it also activates your body's own anti-inflammatory mechanisms, antioxidant mechanisms.
Absolutely.
Yeah, it can be antiviral and kill bugs, which is powerful. Yep. So I think it sounds like a wacky therapy, but it's something we do here at the Ultra Wellness Center.
Yeah, I mean,
it's something that is, I know we were talking about earlier that when we both heard our patients talking about this, and I often heard this, Dr. Hyman, I tried everything and I did ozone therapy and it was the thing that made me better. And I was like, oh, that's interesting. And I had a little footnote in my head, but I was like, that's a little weird. I don't know about that. And when I got sick with mold toxicity and autoimmune and colitis, it was the thing that actually flipped my body into a healing response.
Exactly.
And it doesn't treat any disease. It just activates your body's own healing mechanisms.
Yeah.
And that's what's
very powerfully,
very powerfully, and very quickly. I mean, I had autoimmune disease, brain fog, and within a few days, it wasn't like it took weeks. It was in a few days I really turned around dramatically.
Mm-hmm. Absolutely, yeah. The other thing which I'll mention as it relates to lupus in women, and I've found this, and actually, again, whenever I see something that's sort of out of the box thinking, I'll go into the medical literature to see if it's substantiated. And what I found is a pattern in patients who have lupus is their estrogen detoxification pathway. And when we check estrogen levels and hormone levels in patients, we don't just check your estrogen and maybe your progesterone. We check all of the hormones, and then we also check the metabolites of the hormones. And I found this pattern in not all lupus patients, but some lupus patients, is they have a increased pathway for metabolism to what's called the 4-hydroxy estrogen. And 4-hydroxy estrogen is not, you're not going to go to your regular doctor or your OBGYN.
They won't check that.
They're not going to check that.
It comes out in the urine.
It comes out in the urine, exactly. It comes out in the urine. And I learned about this through Jeffrey Bland.
And it's one of the things we test here at the Ultra Wellness.
Exactly. And Jeffrey Bland, he basically called this, like the dancing Shiva. And in some individuals, because women's hormones go up and down, and they have to be detoxified throughout the monthly cycle. And you oftentimes will see patients who have lupus, they'll flare with their cycles. And when you measure their 4-hydroxy estrogen, they're very high. And the 4-hydroxy estrogen is what's called a quinone adduct. So it damages DNA. And when you have high levels of this over time, it actually increases your risk for breast cancer.
So this is why you think women might have a higher risk of lupus.
Absolutely. Absolutely. And I have a literature paper that cites this, and I've been doing it in my own little cohorts of patients, and I oftentimes check it. And in a lot of patients, they have that. And then the other thing that's interesting.
Wait. Before you go, I just want to unpack that, because that was very powerful what you just said. What you just said is that there are some women who have trouble metabolizing estrogen, and it goes down a pathway that produces a toxic estrogen that damages DNA, which is what we see in lupus. And that by fixing that, and we know how to fix that with functional medicine using food and various nutrients and herbs that actually help upregulate or fix those pathways, these patients can get better.
Absolutely. Yes, absolutely. And the other thing that...
So by the way, most traditional doctors would not be looking at your hormones if you have lupus.
Right. And then the other thing that we then do is we then look at the genetics. So we look at your genetic pathways. So there's a specific polymorphism called the 1B1 pathway. And when that has a variation, you are more prone towards producing the 4-hydroxy estrogen. So typically you start, lifting
And how would
up.
you fix that?
Well, what you do, and interestingly, the particular SNP that's involved in that particular pathway that gets actually upregulated by polycyclic aromatic hydrocarbons. Basically, if you eat a lot of charcoal broiled food and barbecue, you're going to be upregulating that pathway. So a patient who's got lupus, you don't want them eating.
Whether you're grilling your vegetables or grilling your steak, it's
exactly
going to cause the same problem.
Exactly, it's the ash. Those compounds, blackened stuff. Exactly, that upregulates that enzyme. The other thing which you can do is by adding through your diet cruciferous vegetables, supplements like DIM. Helps to shift that pathway in a different direction.
They published a study in 2015 where they looked at people with his type of condition, his type of heart failure, went in and did heart muscle biopsies on all of them and found that 20% had Lyme DNA. They made a point in the study to say that almost 2/3 of them had negative Lyme tests. So if you don't really have a big suspicion about what these infections can do, you're going to miss it. And I've treated about 50 cases.
See, what you just said was really important. I want to emphasize it. You say that 20% of the biopsies in the heart muscle were positive, but 2/3 of the people who had the positive test had a negative blood test. So in other words, you can get a blood test, it can look fine. Yep. Your doctor says your labs are fine, you don't have Lyme, but actually if you look deeper, you can actually find it because it may not always show up in the regular lab test. That's an important point.
Yeah, but you have to ask yourself, who goes and gets a heart biopsy to diagnose Lyme? Like, it's the silliest thing. Like, the tests are antiquated. They're like 40 years old. I always say I won't get on a 40-year-old airplane. I'm not going to trust my health to outdated technology with blood testing. But long story short, he wouldn't evaluate him because the guy, my dad never had arthritis and he didn't have Bell's palsy. He said, "You're a doctor now, do it." I was just, fresh out of school basically. And I basically treated him, and he his heart function completely normalized. He's 88 years old now. He never needed a heart transplant. He's not in heart failure at all. And that's the story.
That's incredible. So what you're saying is essentially you cured an incurable condition, according to traditional medicine, with treatment of his Lyme disease, which was causing his heart failure. And I think this is sort of important to underscore because so much of what we see in my world, in your world, people who are suffering from chronic illnesses who just don't get better, bounce from doctor to doctor, and are often misdiagnosed because doctors often don't have a framework for looking at root causes. And, functional medicine is this framework for looking, whether it's heavy metals, which I've had, or Lyme disease, which I've had, or babesia, which I've had, or mercury, which I've had, or mold, which I've had. These are things which are typically ignored by traditional doctors. Even diet, for God's sake, which is more obvious, is often also ignored as a root cause of so many chronic illnesses. And I think what you're talking about is that there is hope for people who suffer and who struggled if they can figure out how to get to the right person, which is not always easy, but to even advocate for yourself and say, look, I've got this problem, but I'm not giving up, and I'm going to go kind of dig until I find what's going on. And yeah, it could be a number of different things from a perspective of causes that can cause the same syndrome. So you can have rheumatoid arthritis, but it could be heavy metals, it could be gluten, it could be Lyme, it could be Bartonella, it could be all kinds of things. But we basically just lump everybody into the same category. Oh, you've got rheumatoid arthritis, or you've got this or that disease. And we go, we know what to do. We give you the drug for that disease, but it doesn't really speak to the cause. And that's really what you guys have been talking about. It's so refreshing to hear you talking about that. So Dana, I want to sort of jump to you for a minute. You got sick, and you also developed a Lyme-induced heart failure, and you're a pretty young woman. And you sort of talk about how you got a tick bite and a rash, and everything kind of went downhill from there. And you went to doctor after doctor until you kind of found Dr. Phillips and got treated. So tell us about your story and how you end up being treated by Dr. Phillips, and what happened to you and how you got better.
Sure. So it was the summer of 2014. I was truly at the prime of my life. I just signed a brand new deal with Sony and just wrote the songs for Celine, and I was supposed to be traveling all over the place. And I was incredibly happy. So I say that because when doctors start saying like it's in your head, or you're making it up, or you just want attention, like those kinds of things are absolutely insane to me, because so many people are like me, where they get really derailed at the prime of their lives, and nobody would make this stuff up. It's absolutely devastating. So I got a tick bite. I saw the rash. I got it within 5 days. I caught it because I knew when I got back from New Jersey and got back to Manhattan where I lived, and I saw it. I was lucky that I was in the minority that saw the bite and the rash on my shoulder. Most people never see it, and many strains of Lyme do not produce a rash, and many other tick-borne infections produce no rash. Yeah. So that's an important thing for people to know. So I went right over to urgent care. I knew it was Lyme. They knew it was Lyme. They gave me 3 weeks of doxycycline, an antibiotic, and said, you'll be fine. Go on with your life. They also told me not to Google Lyme, and that I would get scared, and that I don't want to be a crazy Lyme person. That was a clue that something really weird was going on. I had no idea that this very common, ubiquitous infectious disease that drives a pandemic of illness was a political hotbed. Like, I had no clue. So I do take the doxycycline. I try to move on with my life. And 3 months later, I wake up, all hell broke loose. The first symptom was that my breast was swollen overnight. I had all these fibrocystic changes and extreme pain. Went to the internist. She panicked. She sent me to an oncologist that day at Mount Sinai. He ruled out cancer. He agreed my breast was swollen. He agreed this was weird. Didn't know why. Just knew it wasn't cancer. Sent me on. I went to go on to have fibromyalgia, exercise-induced incredible weakness. There was a little gym in my building. I did my same lame workout that I do all the time. And just one day my arm stopped working in the midst of all of this. Literally couldn't lift a fork, couldn't feed myself, couldn't walk my 29-pound dog. And I went on to have incredible body pain, brain fog, visual disturbances, anxiety, depression, intrusive suicidal ideation, where I literally couldn't stop thinking about jumping out my window, but I didn't want to, but I couldn't stop. It was like a monster took over my brain and my body. I went on to see 3 infectious disease doctors, tons of internal medicine and the oncologist and sports medicine, and nobody had any answers. And I would ask them, especially the ID guys, could this be related to the tick bite? No. Why not? Because you took the 3 weeks of doxy and it's cured 100% of the time in the test tube with doxy. Okay, that's actually totally not true. The other reason that one of them gave me, this is my favorite, this well-known doctor at NYU said to me, because I went to medical school. So I'm like, well, ticks carry other infections too. is there anything else? I was pushing them. At some point I said, do you want to test me for inflammatory markers, like anything? He goes, oh, that's a pretty good idea. Okay, well, this is my third visit with you. Are you kidding me? So I went on to have this horrible experience until December, when I went into heart failure. And then everybody like really got serious, really believed me. I mean, I do think some of them thought it was in my head, because I had so many weird, disparate, migrating symptoms that doctors are when they don't understand something, they put you in the psychiatric bucket. That's a theme. I think, of course, you know that very well. So, and when you have these things, you do feel crazy because nobody can give you any help. And also the fact that it's changing all the time and every day, it really feels crazy. So then in December, I went into heart failure. My ejection fraction was 40%. Under 50 is considered heart failure, for people who don't know. And yeah. And it was, I mean, I was so healthy before all of this. So then, thank God, I had a friend who knew about Dr. Phillips and seen him testify at some hearing, and like knocked it out of the park and said, you got to go see him. He's brilliant. And he's the only person I would see if I was in your position. So I went to him and he saved my life. And, within like 2 months of seeing him, my heart failure totally resolved. And he did talk to the Mount Sinai cardiologist, who had been very concerned about it, did take my heart failure seriously, just didn't know the cause. And Steve really educated him about, Lyme carditis. He didn't really even know very deeply about it. He was interested and he was educable. He was the only one, but he was, and I really appreciate that. But I was treated with a rotating course of antibiotics, antimicrobials, I did a Chinese herbal protocol as well, called the Zhang protocol. There are plenty of them, of different Chinese medicines you can take. That was the choice I made because I lived in Manhattan and it was in the city and I could see them. And anyway, Dr. Phillips really came in and got me better. It was a miracle.
Yeah. Well, I hear this story so much that people, often suffer and they really struggle with trying to figure out how to get the right treatment. But, I think what you're speaking to is the need to think deeply about rethinking medicine. One of the things I want to sort of jump into with both of you, and you talk a lot about these kinds of things in your book, Chronic, which is great. It's called The Hidden Cause of Autoimmune Pandemic and How to Get Healthy Again. And it's available now on Amazon everywhere. And people should get a copy. If you've been struggling, this is going to help you understand what's going on and maybe guide you to the right resources. What really is going on is that, there's these chronic latent infections with clearly the tick infections, which is Lyme, Bartonella, Babesia, Ehrlichia. And there are lots of varieties of each one of these. So they're often hard to detect. The testing is sort of a little bit outdated, as you mentioned, Stephen. And I just wondered if you could speak a little bit about the testing. And then I want to sort of jump into talking about COVID and COVID and latent infections and autoimmune disease, because I think it's a topic that people are talking about a lot, and I think people don't understand what that means in long haul COVID.
So the many infections do have an unfortunate commonality, is that they're fastidious. It's a term that microbiologists use to describe, infections that we can't isolate from animals and people that have the infection. So Lyme is probably the best studied of all of them. If you inject Lyme bacteria into a dog and then let the dog get sick and then take the dog's blood sample a month later and the dog has Lyme, you can't find the actual bacteria in the blood. And it's the same for all the animals studied and same for people. And with the animal studies, they can cut them up and find that there's still Lyme bacteria alive after the same treatments that are supposed to cure it in humans. And in humans, they don't cut us up, thankfully. And that's the main difference in terms of the animal data and the human data. But they've isolated this bacteria. Even though it's so hard to isolate, they've still isolated it from about 75 patients, human patients, after up to 2 years of antibiotics. So it could be a really, really stubborn bacteria. But believe it or not, it's easier to treat, in my experience, than some of the other infections, particularly Bartonella. Tularemia is really rough sometimes. And so can Coxiella. Q fever is very, very difficult. And then the parasitic infections that people never talk about because we're told to ignore them in med school. But I do a broad range of a blood test panel for antibodies against 9 different parasites whenever people come in. And it's shockingly common. And the interaction between parasitic infections and bacterial ones is such that the parasitic infections facilitate and perpetuate the bacterial ones because they're a bit immune suppressive. And
so you're getting also viral infections that underlie some of these chronic things too. And right now we're seeing this viral infection, COVID, and what we're seeing, even more scary to me than the actual COVID, because most people recover from that, is the long hauler COVID syndrome, which we've talked about on the podcast before. Essentially, it's a chronic fatigue-like syndrome. And with the first SARS infection, decades ago, about 40% of people who survived, and it was a much more lethal infection, 40% of people who survived got chronic fatigue at 3 years. And we're seeing this now. We're seeing people who have not even been that sick, people who are young and healthy who got it and recovered and just never get better. So can you talk about what this long hauler COVID syndrome is, how it relates to the underlying potential other factors that are going on with people, like chronic infections? What do we know? What do we not know? And what's your experience in treating some of these patients?
So my experience in treating just regular COVID, acute COVID, has been overall very, very good. And patients have responded to things like doxycycline, ivermectin, and a bunch of herbals like vitamin D, vitamin C, zinc, quercetin, and bromelain. However, my experience with long COVID is a little bit different. I only have one true long COVID patient. She's a person who didn't call the office for her acute COVID situation. She called her primary care doctor, who said just take Tylenol. And then 3 months later, she called 11 doctors in desperation. I was doctor number 11. And I actually gave her ivermectin, and she turned around in 24 hours. I do have one patient I actually just spoke to today who had a mild case of COVID. And after that, her Bartonella symptoms are very much flared up. And we're trying to figure out, is this still virus persistent in her body? Is that what's driving things? Or is it like the apple cart was just upset immunologically and her prior Bartonella is flared up? It seems to be actually the latter in her, because she's responding to the antimicrobial therapies she did before with Herxheimer reactions, which are these die-off reactions, and all these things that all got worse since her COVID are responding to, the same antibiotics that I would treat somebody with Bartonella. So I'm wondering if some of these long COVID patients people don't understand that, we think about these infections that they always cause illness, but the majority of these chronic infections that we're talking about today don't make people sick, or if they make them sick, they make them mildly sick, and they never really get a diagnosis. What happens when you come with a long, a bad viral insult? So before COVID came along, I would have people who had a really bad flu, and then they were never the same, and then they develop a chronic fatigue-like picture. And we do an evaluation for chronic infections, find some, treat some, and get them better. I don't think it's that dissimilar. I think COVID is a terrible, terrible virus, but I think it has the same common features with other viruses that I could just, like I said, be a big shock to the immune system. And it's ridiculously common how many of us are walking around with chronic infections we just don't know about, that never get diagnosed.
So how do we then attack this long hauler COVID? Because I think people are curious about, okay, well, I'm not feeling well. I've had COVID. I want to get better. I don't know what to do. And what are the kinds of things you're seeing as one, any diagnostic information you're getting these people? And two, what are you finding works clinically to treat these people and help them get better?
Well, it's hard to find the virus. In the studies, the people that have had persistent active virus, it's been basically GI tract biopsies and biopsies of the olfactory bulb near the brain. So it's not just your listeners should know, it's not just go for a nasal swab, and when it's PCR negative, that rules it out. So the virus can persist in hard to biopsy places. And these tests are not available at like routine drive-through centers. It's really like a research test. So doctors don't have the ability to do that outside of a research setting. In terms of looking for these other infections, any doctor that's educated about these can look for them. I do 99% of my blood tests for patients at chain labs like Quest and LabCorp, and it's a long litany. It's like 17 tubes of blood, but we cast a broad net, and we try to find targets that are treatable.
And in terms of the clinical symptoms people are having and the treatments that are working, can you tell us more what you're thinking about how we should be approaching this?
So there's a subset of long COVID patients that are, have some common features. The breadth of symptoms is really, really, it's incredibly broad. And there are some things that I'm hearing about in long COVID patients that I see in my chronic illness patients, and they're very weird symptoms, like a sense of internal vibrations. I don't know if you've had patients that ever complained of that to you, but this is a common, common complaint among my patients. And it's something long COVIDs are complaining about, long COVID patients. So as soon as I heard that, I started getting very, very suspicious that, wait a second, is this really flaring up underlying infections that we see. And in my one clear, long COVID patient that I've seen, it's she responded to ivermectin, like I said, overnight, and she basically had chest pressure and pain with breathing, and that was her persistent manifestation of COVID. It's not something she ever had with her prior illness. She was a patient who was treated, over a year or so before, she'd been fine, since I treated her, got COVID, and had this chest pain. So she developed a new symptom, and very quickly responsive to ivermectin. So ivermectin, I don't know if you've talked about ivermectin on your shows before or no.
Yeah,
but ivermectin is an antiparasitic. It's a really safe drug. Yeah, so it's I've had experience with it way before COVID came around, because I used it because I do, like I said, evaluate and treat parasitic infections, and I've also used it as an immune modulator. So ivermectin has this really cool many effects in the body. It gets rid of abnormal inflammation, and it gets rid of abnormal immune suppression at the same time. So it has immunologic benefits for people with inflammatory illness, but also in the case of COVID, has a direct antiviral effect. So so if I have a long COVID patient, I'm going to offer them something that's going to cover the virus, and I'm going to evaluate them for the other chronic infections that COVID could have stirred up, and what we find, we'll offer treatment for those as well. I would take a dual approach.
Yeah. And are people getting better, you think? Because I think a lot of people are worried about the long haul COVID syndrome and people not actually recovering fully from it.
Well, I've been booked out for so long that we haven't even, long COVID patients are calling the office, and I'm just gathering data among my patients now who have had COVID. Like I said, limited experience in treating long COVID patients. So I'm going to start accepting long COVID patients and evaluating them the way that I said, using this dual approach to cover the possibility of persistent viral stuff going on, and also the possibility of flared up other chronic infections like Lyme and Bartonella and other chronic infections that people may never have heard about. And, I do think that I can help patients, but I don't have a big well, of experience to draw from. I don't know how many long COVID doctors are there have a big well of experience on what's working, because from what I'm hearing from the long COVID community, because we're partnered with Survivor Corps, which is a large group with long COVID patients. And so far, there's very limited trials of stuff to get these patients better. Like, none of the doctors are really taking it by the horns, so to speak, and really helping these patients.
Well, we've got a clinic at Cleveland Clinic called the Recover, RECOV, right? Like for COVID, Recover Clinic. It's a multidisciplinary clinic around how to recover from COVID, from the long hauler syndrome. So I think that there's some interesting things happening around the academic centers. We're looking at all kinds of options. And I do think functional medicine approach is really powerful. And I think for people listening, there's a lot of approaches to chronic infections, antibiotics, herbs, lifestyle, and more. Some of the other things that we've talked about in the show, like ozone and hyperbaric oxygen therapy, hyperthermia, and other approaches can be actually also very effective. And clinically, I find some of those really helpful in resetting the immune system and resetting the way in which your body handles infections, even directly killing infections. So I think there's a lot of tools out there and options. We did a podcast from Santa Vive where I went, and I personally had Bartonella. I was really persistent. I was having night sweats, still fatigue. I was functioning pretty well, but I still really, struggled. And people who do kind of well, they're walking wounded, are often the ones who have good lifestyles, but they still have this low grade stuff. If you have a crappy lifestyle and you get this, you're in trouble. It's really bad. But I got the chance to do hyperthermia, which was an interesting treatment that's not available in the United States. It's in Europe and in Mexico. And I was able to put my body to 107 degrees. And after that, and getting the antibiotics during that time, during the peak of the fever, allowed my system to start to respond and shift and recover. And I just talked to another patient who had Parkinson's disease, who also had Babesia and Lyme and many other co-infections, and really found the same thing. We treated him with lots of antibiotics and herbs and things over the years, but finally we got him to do treatments of ozone or hyperbaric oxygen and hyperthermia, and he went to Santa Vive, and it was really quite remarkable. So it's not available to everybody; it's expensive, but for people who are really struggling, there is often a way out. So, Dana, tell us about your perspective in terms of interacting with your own, health and the medical community, and the struggles you've had, and what you're doing to kind of change how people are shifting the perspective of how we can get better?
Well, one thing that I should have mentioned is that, which speaks to this, is that when Steve worked me up, he found another infection, Bartonella, that was also driving my symptoms. So my Lyme was definitely undertreated. There's no question. 3 weeks of antibiotics is definitely not enough for many, many, many people. The data is clear. So I should say that. But the fact that nobody looked for anything else is crazy to me. And when he treated both of those infections, all my symptoms went away, my psych stuff too. So I think that point needs to be made. I think a lot of people suffer from anxiety and depression along with their, quote, autoimmune diseases. And people tell them, well, you're anxious because you have fibromyalgia or because you have RA. No, you're not anxious because you have those things necessarily. I mean, yes, they suck. It's depressing, but there's a brain component here. There's a neurologic component, just like we're seeing with COVID. And I think it's a lot easier for doctors now. Well, not all of them. Okay. They're coming around to the fact that infections can cause a humongous multisystemic illness that lasts and lingers. And that is driven by a stealth chronic infection. So that, there's so much for them to learn. If they'd been paying attention to Lyme for the last 30 years, we wouldn't be in this horrible mess with COVID, in my opinion, with long haulers, because I think it would be very obvious that there are chronic infections driving some percentage of these people's symptoms. So, it's a bit crazy making to me to watch this all being, predictably played out the way it is, where we're talking about immune suppressants already, and we're not talking about antivirals. These things need to be put on the table. But in terms of my interactions with the medical community, and my advice is just, if I didn't advocate for myself and if I didn't trust my intuition, I knew they were all wrong. Yeah, it made me feel badly that I wasn't being taken as seriously as I felt I should have been. It made me feel badly to have the sense that people thought it was in my head, but I kind of didn't care that much because I knew they were wrong. And I think everybody has this inner voice that tells them, this is the wrong path. This doesn't make sense. But most people don't follow it. They need the confidence. So if I can be, a guiding light in that regard and just tell people to keep going and go move on from doctors that aren't believing you and that won't look at data or won't listen to other stories that are similar to yours, stories like mine where people recovered. I say move on, but I also feel very strongly that you need to bring somebody to an appointment with you, because when you're really sick like this, you need somebody to advocate, ask questions, write down information, because you forget a lot of stuff when you're in this state. And I just say, as you just said, like, don't give up. There's a lot of ways to skin a cat. And this is my journey, but there are many, many other people I know that got better in various ways. Just look for the root, though. Demand the root cause answer. Demand it. If you don't find it, that's what you got to keep going for. That's my opinion.
Yeah, the challenge a lot of times, Dana and Stephen, is that with traditional medicine, we're not really trained to look at root causes most of the time. Sometimes we do, but most of the time we don't really have a framework for thinking about chronic complex illnesses. We're good at acute illness. You had acute infection. Okay, we'll say it's this bacteria. We'll treat you. We'll figure out the cause, and that's fine. But for these latent infections or chronic infections or latent issues, whether it's mercury or mold or Lyme or whatever, people are often struggling for decades, and there really is a method of figuring this out, and really that's what we do at Cleveland and at clinic and at the Center for Functional Medicine at my practice, the Ultra Wellness Center. It's what you do, Stephen, and a lot of doctors around the country are moving towards this kind of medicine, and people call it functional medicine, or whatever you want to call it, but it's essentially a new framework for thinking about disease based on treating the body as a system, about getting to the root cause, about understanding the interconnections between these things, and thinking out of the box. I mean, just the idea that you could cure heart failure by treating an infection, that's a kind of an interesting idea. We know that viral infections affect the heart and cause heart failure, but we never really, and we even know from the literature that Lyme does too, but it's just sort of a blank spot that doctors don't pay much attention to. So really grateful for both of you for taking this on, writing this book, Chronic, the Hidden Cause of Autoimmune Pandemic and How to Get Healthy Again. There's a great chapter in there on COVID and how we need to think differently about COVID and autoimmune disease and chronic long hauler syndrome and some of the stuff we're really struggling with. If you love that last video, you're going to love the next one. Check it out here. I do the same thing I've done every day for 30 years, which is use the matrix, which is a map of how the body works from a functional medicine perspective. So I look at all the predisposing factors, those 5 things, and I dig deep into those. I look at their lifestyle, I look at their mind-body stress, and I come up with